Harley, should we get started on time so that we don't
I
lose
think
our...
so. Yeah,
Okay.
just in the interest of everyone's time.
Okay. Is there anyone in the waiting room or is that it? Oh, we got some people on. All right. Well, good day, everyone. I'm Tina Papadakos. I'm Director of Knowledge Translation within our Cancer Education Program here at the Princess Margaret. And on behalf of our session presenters and discussants, welcome to the session on Global Oncology Leadership Development as part of London Global Cancer Week. Uh, I just need to be able to move the slides. There we go. This is a two-part session. First, Dr. Meredith Giuliani, who directs our cancer education program at the Princess Margaret Cancer Center, will provide some context from the literature about why leadership is important and what it means to cancer control. And then I'm going to share some more detail about some of the leadership programs that we run at the Princess Margaret and touch on some of our collaborations with our global partners at Tata Memorial Hospital and AC Camargo Cancer Center in Brazil. We're also going to then have a panel discussion as part of part two with the folks on the slide. You can see here we have Dr. Meredith Giuliani will join us again from Princess Margaret, Dr. C.S. Pramesh, who's the director of Tata Memorial Hospital in India, and Dr. Jose Fregnani, who's the superintendent of education and research at AC Camargo. And they're going to be joined by two of our leadership program development alumni, Dr. Daphne Valmonte, a radiation oncologist at Makati Medical Center and Asian Hospital Medical Center in the Philippines, and Dr. Christian Schultz-Kwok, Medical Director of Workplace Violence and Prevention at the University Health Network. So we have a full session for you today. I'll now invite Meredith to start by sharing some of the highlights from the literature about the importance of leadership in oncology, and then I'll take you through some of our programs. Over to you, Mer.
Thank you so much, Tina, and thank you everyone for joining us today. This is a really important topic that everyone on this panel is very invested in, so we're excited to speak to you today. Maybe just to situate why we're so interested in leadership development and have focused so much time and resources into that space is that leadership styles are significantly associated with improvements in healthcare. So the ability for the team to collaborate, the ability to retain your staff and to recruit top talent, and safety and quality for patient care. So organizations where you have a collaborative leadership style, there's good team cohesion, you can see a reduction in safety incidents for patients and a higher level of collaboration. And I think many of us that work in the space know that higher levels of collaboration often lead to more innovation. Go to the next slide. So what about specifically in oncology? I think we know that cancer care is highly complex and an interdisciplinary effort. And leadership skills and the tone that the leadership sets will not only drive quality and safety and innovation, but helps that team collaborate together well and deliver high reliability in terms of patient care. And so what about when we take the global lens? So we're sort of talking about the departmental or institutional benefits of improved leadership skills, but it's really essential for advancing global cancer control because what we're doing is taking those skills that are needed at the local level for high levels of collaboration. And we're really saying we actually need to see that across provinces, across states, countries, or in between different countries. And so those skills translate into being able to work together across jurisdictions to understand differences, to investigate and understand complex problems and work together to make things better in terms of cancer control. Go to the next slide, Tina. So just to give you a very brief overview of the evolution of leadership theory, and if you'd like to watch, we're not going to play it today just because of time, but if you have 5 minutes, the Zigarelli's 10 Leadership Theories in 5 Minutes is a great video that would orient you to this concept over the last 30 or 40 years, how leadership theory and leadership style theory has evolved. You're probably familiar with the concept of the great man theory. This is where people often orient when they think about leaders. And the concept of the great man theory is that it's very historical, and it's that leadership is viewed as something innate. suggesting that leaders are born with some exceptional qualities like charisma, courage, and natural authority that somehow makes them great leaders. And we can sort of put an X through that one and say that really today that's a very outdated concept, because we know that leadership skills are highly teachable, that everybody has the opportunity to develop their leadership skills. So we sort of moved on in time to something more called the trait theory. And that really shifts the conversation from something that you're sort of born with that makes you a great leader to having some characteristics that might lend themselves well to working in leadership roles. So leadership's things like integrity, confidence, intelligence, sociability, but there's no universal list of traits, which is where this one starts to have some issues. So there are things that might be helpful, but there's no perfect list of traits that would mean that that's exactly who you want as a leader. So what about situational leadership? So as we're moving through time, situational leadership, and you'll still see this today, is really around adaptability. So there's no one best, the concept of there's no one best leadership style. And effective leaders can adjust their approach to situations and teams depending on who they're working with, the situation or problem that they're trying to manage. And that can be very highly practical in the concept of healthcare, because I think we're all familiar with how dynamic the situation in healthcare can be, and that you may need to flex the skills that you're bringing depending on what the problem that you're trying to tackle or the strategic direction that you're trying to move your team into. And then sort of the more recent concepts of leadership is this servant leadership theory. So the idea that it's emphasizing service, humility, putting your teams and people first. And the leader's job is really to support the growth and well-being of their team, because you're working with a highly skilled team of people and you want them to deliver on all of the things that they're skilled and able to deliver on. And that really works well in healthcare when we think of how complex, interdisciplinary, interprofessional the work in healthcare is. And it leans into that sort of concept of service and compassion. So we lean into that a little bit. And for those of you that study leadership theory, there's a nice diagram, and it's a big umbrella, the leader holding a gigantic umbrella and their team sort of working underneath the umbrella, and the concept that the leader is really there to shield their team and get them the resources and the space and the collaborations and the things they need to be able to do the work and deliver on either the strategic plan or the goals or whatever it is that the team's trying to do. So that is leadership theory in a couple of minutes. But as I said, if you do want to watch that video, it'll give you an even more in-depth historical overview. And Tina, I think we're handing over to you.
Okay, so we're just going to take a moment to ask you a question. So what do you think it takes to be a good leader in these modern times? Please go to www.slido.com and enter the code on the side, and we'll have a look at what you're saying. Arlie, are you able to put the code in the chat so I can go to a Slido screen so we can see what people are saying?
Sure. Yeah. Let me just copy it really quick.
So, thank you. All right, I'm going to stop sharing so we can see what's happening on Slido for a minute. And that's my share button. There it is. Go. All right. Vision, expertise, and group process, empathy, reflexivity, passion. Yeah. Collective psychology, group process. Okay.
Yeah, great list. I think we're going to touch on a lot of that. That's a great list. And I think we'll go back to the slides, but I think as you look at that list of things, you can see where the things that you're identifying are things that you can learn, and B, as you move through your leadership journey, you can get better at those things. And you learn sort of through experience. So that's what we really want to encourage you. And Tina's going to talk about some of the educational programming, but these are things that can be learned. So I think we can go to the next slide. So what about leadership skills training? So the idea is really to deliver educational experiences that will help with leadership skills. And understand the concept that the paradigm that we talked about, that leadership theories over time is really changing, and that it's career-long opportunities for leadership. When you speak to really senior leaders at the end of their career, and they will tell you they're always learning something. And I think that's another thing we could have added to that Slido list of that ability to just sort of continuously learn and be curious about what can be done. So we can go to the next slide. And 2030 is now getting very close. We talk about these numbers a lot, but the new cancer cases are increasing very rapidly. I think we see that all in our own jurisdictions, and some modeling work that was done in one of the Lancet commissions on cancer, actually now, over a decade ago, really said that we needed to double our cancer workforce by 2035. And those of you that are involved in sort of training or retention of healthcare professionals know that that is, quite an impossible feat, and that we really need to understand and have more adaptive and trans-professional teams to sort of do more with a workforce that's probably not going to double to keep pace with the volume of cancer cases around the world. And then we also, which is a great story, we have more people that are surviving a long time with cancer or being cured of their cancer, and we still have to support those patients with their unmet care needs. And that's another evolving space, which is a success story, but also something that needs attention. So Tina, I think I'm going to turn it over to you, and we'll talk about the programs.
Thank you so much, Mare. So one of our responses to a lot of these trends in the literature is that we've established the Princess Margaret Cancer Leadership Institute, and it's our institutional home for our leadership development programs. And the Institute supports multiple programs that are tailored to different entry points. It includes researchers, clinicians, non-clinicians, fellows, trainees, and early career professionals. And we're closely aligned with our cancer education strategic plan, which we just finished writing, and it's a 5-year plan. And it explicitly identifies building a robust leadership pipeline as one of our goals, ensuring that the workforce is equipped to manage the challenges of modern cancer care. And on this slide, you can just see a screen cap of the cover of our strategic plan. If you're interested in reading our education strategic plan, you can just get a quick shot of the QR code there, and we can also share this after the meeting. I'm going to keep moving though, because we have a little bit of a tight timeline. So while it's really important to establish leadership capacity through programming, it's also really important to recognize that there's barriers to leadership development that can limit these opportunities for different people. These obstacles, ranging from financial costs, time constraints, to geographic challenges, can reinforce disparities in leadership representation and ultimately inequities across the health system. There's systemic factors as well, including biases in selection and promotion, or conscious and unconscious racism, sexism, ageism, and others that can further restrict access to leadership opportunities. And since we know leadership can be learned, this is a really big barrier and problem. So our programs are very much foundationally designed to reduce these barriers. They're offered at no cost. They're sponsored by the Princess Margaret Executive, who actively encourage participation across the board. And they're scheduled to minimize disruptions while providing, and they're also on site, so people don't need to travel far. They're open to everyone who meets the professional criteria for that program and complete the application process. And the programs help reduce selection bias and are widely advertised to make sure that we're getting to the audiences themselves, not waiting for them to be tapped by someone to try to find the opportunity. So with these foundational principles in place, I'm now going to talk to you briefly about each of our 3 leadership programs. If my slides can move. Oops, did I miss something? Yeah, here's the 3 leadership programs. Gold, our Global Oncology Leadership Development Program. Bold, Biosciences in Oncology, and Young Leaders. And I've also included mentorship through the Princess Margaret Elders Counselor Program, because this is, while it's not necessarily a leadership program per se, it's closely integrated with our leadership development initiatives, and it's an important thing to talk about. I think you'll find it interesting. So our Global Oncology Leadership Development Program, GOLD, is an interactive group program designed to equip clinical fellows with the skills, networks, and opportunities to lead cancer care at the local, national, and international level. And this is really tailored for Princess Margaret fellows, so people who are visiting Princess Margaret to specialize. And many of these people are international, and this program is really intended to help them drive change back when they go home. and this can also be for the Canadian fellows too. The curriculum covers system-level topics like policy and economics, research and innovation, and core leadership skills such as self-awareness, collaboration, and interprofessional collaboration. The program combines an international faculty. It's got workshop, interactive sessions, mentorship, guided reflection, and this supports building the knowledge and the practical skills to lead. Gold runs from fall to spring, and it's between 3 and 5 sessions, usually about 1 or 2 days each. Gold has also included, since it started in 2019, it's also included 3 to 6 people online who are joining from the Tata Memorial Hospital in India. And these people are nominated by CS Pramesh. They complete all of the program requirements online, and they're also prepared with local mentors in India. So when you look at Tata affiliated fellows who are physically at the Princess Margaret, plus the fellows who join online, close to 40 people have joined from India through CS Pramesh. And several participants from AC Camargo in Brazil have also joined online in the past, further expanding our reach. So since 2019, 206 fellows have participated in Gold and representing more than 50 countries. And most of these people are from low and middle income countries. Gold is evaluated every year using a mixed method approach. Evaluations show that participants report significant increases in confidence post-course. They have greater skills in various leadership domains, greater self-awareness and empowerment and they feel higher self-efficacy in their own ability to lead. They also build networks, lasting networks with their mentors and colleagues, and they gain new perspectives. Many have gone on to secure funds and grants together and assume leadership roles as part of the results of the program. And you can see at the bottom here a picture of our first year's cohort. And this is a very exciting development. Building on the success of our Gold program, we've also began adapting the program for international context. So in partnership with Dr. Jose Frignetti and his team, you can see them in the picture here at AC Camargo, we've secured a seed grant from the Princess Margaret Global Cancer Program to develop a custom Gold program that will be run in Brazil, locally. We launched a needs assessment there, that's what this picture is, and we're working together to co-develop what the program will look like on the ground in Brazil. And we're learning a lot from Jose's team too, and it's really helping us actually improve Gold in Toronto. So collaborations like these with Pramesh in India and Jose in Brazil are helping build leadership capacity in local contexts, and it's going to strengthen our global networks and foster shared learning. And we will hear from Pramesh and Jose on the panel a little bit more about what this has looked like for them. So I want to talk to you about our Biosciences and Oncology Leadership Development Program. It's really targeted to PhD and postdoctoral researchers who are interested in building their leadership skills and networks. So like Gold, it's got a focus on intra and interpersonal skills. It also includes mentorship, global faculty, and an emphasis on peer connections and networking. Because actually one of the best things that comes out of these programs is the relationships that are built during the longitudinal flow of the course. The reason Gold is so important is because we know in scientific training there's a heavy focus on technical and analytical skills. What's often missing are the soft skills and leadership abilities that scientists need to advance their work. There's kind of an assumption that these skills are just going to be learnt on the job, but that's not always the case. So the literature highlights some key competencies for scientific leaders, and you can see them here on the slide. So leadership developments are really our leadership development program, Gold, is really geared to fill this gap and bridge that technical excellence with the broader skills that are really needed in today's modern scientific landscape. So like Gold runs fall to spring, and it's also between 3 to 5 days, 1 to 2 days at a time, providing that immersive opportunity for people to focus and learn in full day sessions. Like Gold, the Gold program has shown perceived improvements pre and post course in self-perceived confidence, but the numbers only tell part of the story. Our evaluation framework also includes semi-structured interviews with alumni, and that gives us a much richer sense of their experiences. You can see some of their comments on the slide, but I want to read one that stands out to me that an alumna said after completing Gold. He said, "I'm trying to be a better collaborator, to listen more, to be more calm, and to be more mindful." And to me, this captures exactly what modern leadership looks like: leaders who elevate others, who build trust, and create conditions where people can work together effectively. Modern leadership is fundamentally collaborative. It requires a blend of skills, perspectives, and ways of working that go well beyond traditional top-down approaches. And on our last program, which is our Young Leaders program, it was developed in 2017, and it's really targeted at permanent staff at the Princess Margaret. The other two programs are focused on trainees. These are on staff who are staying at the organization. It focuses on a multi-professional teams, and it's targeted to staff to get people to lead from where they are at the Cancer Center, not wait to be told what to do, but to actually be actively thinking about improvements and what they can do within the space of their own influence. It's also really geared at building a vibrant community of practice, networking people together and shaping the future of Princess Margaret as a group. It now includes 120 active members and alumni who are still engaged. Since the program launched, over 24 professions have been represented in the membership, and you can see at the bottom of this slide what the program entails. And there's really a focus in this course, again, on those inter and intrapersonal skills, things like change management, presentation, strategic visioning. It also includes some finance and innovation ideas, conflict management, and mindfulness and resilience, because if leaders aren't well themselves, it's hard for them to lead well teams. And I promised I would mention this Princess Margaret Elders Council. This was launched in 2017, and it's a really interesting initiative. It brings together past leaders from healthcare, but also from outside of healthcare, from industry, banking, and business. And these leaders have donated their time to the Princess Margaret, and they use their wisdom to guide our organization. They play a very key role in mentoring and advising different generations of leaders across the Princess Margaret. They provide guidance to the executive team, they provide mid-career leaders with mentorship, and also they mentor participants in our programs like Young Leaders and Bold. And I've just included a couple slides here of some of the key members of this group. You might know Dr. Bob Bell, who is former CEO of University Health Network, but also Deputy Minister of Health. And then on the next slide, you probably know Dr. Mary Gospodarowicz, who actually began the Elders Council. And she's a highly influential leader both at Princess Margaret and globally. So the elders are more than just a network of distinguished alumni. They're a living bridge between generations, which is very much needed, I think, in this day and age. They share their wisdom, they mentor future leaders, and they help shape the strategic directions of the Princess Margaret. So they're an essential component of our leadership development strategy. So at Princess Margaret, our focus is on scaling our leadership development programs globally and strengthening our alumni network, investing in evaluation, continuing to think about how we can evaluate our programs to really pick up on their impact, and ensuring our programs are accessible, equitable, and sustainable. And a lot of this relies on our Princess Margaret Cancer Foundation. So building on this, we're excited to bring the same spirit of mentorship and collaboration to the global stage today. And in the panel that follows, Meredith, our global partners, Pramesh and Jose, and our alumni, Daphne and Christian, will share what we've accomplished together, what we're doing now, and how leadership development is shaping the future of cancer care worldwide. We also invite you to support global leadership expansion, to partner with us, partner with our partners on regional initiatives, and contribute to the evaluation literature and research, and join our community either through speaking with our groups, mentorship, or supporting funding. And just before we transition to the panel, I'd like to just put up this acknowledgement slide, because this is a very big group of people that have collaborated to put these programs together on the ground. And actually, I should have a giant logo for the Princess Margaret Cancer Foundation, who actually makes it all possible. So this will end the talk part of our session. And if you'd like to reach out to Meredith or I, there's our emails. We'd be really delighted to talk to you. And now we'll transition to our panel. So let me grab the questions here. Okay. All right. I'm going to stop sharing so we can see all of our panelists. And good. Okay. So good to see everybody. I hope that wasn't too fast and furious. Pramesh, we'll start with you. Maybe I can ask you if there's anything you'd like to say first, and then if you won't mind answering this question. How do you see leadership capacity influencing cancer outcomes in low and middle income settings?
Yeah, thank you. Thank you, Tina, for involving me in this. And having been a beneficiary of the leadership development program, which the Princess Margaret has started, I can say that it's made a huge impact in how we do things at the Tata Memorial in Mumbai. So I think the formal training in leadership helps outcomes overall, and it does help a lot with the planning phase, with the strategy, starting from a national, regional level, but even going down to an institutional or even a departmental level. And it helps folks kind of prioritize between their multiple competing interests that come in. And given the fact that there's a huge clinical workload, often leaders are forced to choose between one or the other. And this has been a great learning experience for most of our participants in the Gold and more recently with the Bold initiatives that Princess Margaret has said. And I think it kind of sensitizes participants to what they should be looking at when it comes to overall improvement in the kind of cancer control that they provide. And I use the word cancer control in a very broad way, with care, with prevention, with early detection, all the entire spectrum of cancer control that we are looking at. So it's been a great learning experience for all of them. And I think this is the way of formally training individuals on how to lead is an underestimated trait. It's something we've all learned, that leadership is something that can be learned formally. And that's been the biggest takeaway for me from these programs.
Thank you. Do you find, like, I notice that sometimes people are joining in the middle of the night because they want to see the live sessions instead of watching the recordings. What are some thoughts you have about how to build capacity amidst these busy schedules for people? And do you think we'd ever be able to run, or you could do an on-the-ground leadership training program in India?
So I quite like the blended learning module. It's something that we've embraced with most other training programs that we've done. And this comes from the past experience that there are certain things that can be learned and taught and experienced online, but you do need an in-person meeting somewhere in between to actually to get the whole package working. And to me, if resources were not a constraint, I would strongly advocate a blended learning module where a lot of the training happens online, but there needs to be some mandatory in-person learning and discussions which really help with it. And in an ideal world, we would start and somewhere towards the end have an in-person meeting, because people tend to identify a lot better with people they've met in person. There's so much that a virtual platform can offer, but actually having tea with someone who or coffee, depending on whether you're up in the middle of the night, certainly helps break those barriers and make people far more comfortable. And this is especially true in low middle income countries. And I'll come back to this if time permits. What we need to break is the hierarchical models which are so inherent in situations like ours, where you address your seniors, even if they are just senior to you by a couple of years, as sir or madam. And these artificial barriers actually come in the way of good communication. What these in-person meetings do is to completely break those barriers, and suddenly it's hi Ian, and not Professor Tanak that is on the call with you, and I think it makes a big difference.
Thank you very much. Hopefully maybe we can work together on that, getting it on the ground. I'd like to ask Jose the same question. What are some region-specific challenges, or a similar question, that you face in building leadership capacity, and how have you adapted your approach to the local context? But you're mute on there.
I'm muted, sorry. Hi, Tina. Hi, everyone. I'm very happy to be here directly from Brazil. Hello. Well, here in Brazil, we are developing leadership in oncology. We have a different situations and a lot of challenge here. The first is our deep regional inequality. Some cities in Brazil have comprehensive cancer centers, are very good centers to treat cancer, to diagnose cancer. While in some places here, we have a shortage of specialists, late diagnosis, and weak integrations across level of care. This means leadership training cannot be uniform here in Brazil. It must be tailored to a highly heterogeneous country. Well, the second challenge that we have here is that the cancer care for the majority of Brazilians here is delivered through the public health system, what we call here in Brazil as SUS, S-U-S. This is a universal health public system. Effective leaders must, understand the regulation, financing, referral pathways, and the realities of working in a larger publicly funded system. Here at AC Camargo, we have adapted our approach by exposing our residents early and the young professionals to these structural realities in the private and the public health system. Here at AC Camargo, we have the both systems in our hostel. We have the real cases in the private and public setting, so the residents can see and observe the difference when we are making diagnosis and treating patient in this kind of these two systems, health systems. Also, we like to emphasize about the critical thinking. We want that our residents can get engaged in public manager, propose feasible solutions, and understand the difference between the systems, and they can act very conscious, seeing the difference of the system. So basically in Brazil, the big challenge that we have is that we have a very different scenario in terms of healthcare systems, and a different scenario in the south and the north regions is a complete difference. So we are preparing our residents to see this kind of difference to treat all the patients with cancer in our country.
Thank you. It's such an interesting challenge. Just go over to Meredith now and just ask, do you want me to, I'll ask you a very quick question, Mary, and then we'll move on to asking the alumni some questions and then come back to the group. I think this is a really important question because we do leadership training. We're talking about leadership training, but in what ways does leadership development complement traditional investments in infrastructure and technology for improving cancer care? In other words, how do you make the argument to fund leadership development when you have so many other challenges?
Yeah, that's a great question, Tina. And Pramesh and Jose have touched on this already, and we sort of touched on a little bit in our opening slides, where if we can't work together across the institution, across different institutions, depending on how your cancer care in your region or your country is set up, if we don't have the skills to do that, sometimes you might be the leader of the team, sometimes you might be part of the team, and leadership training can teach you how to be good at both of those things. If we don't have those skills, if we bring in new technology, how are we going to implement it safely into the clinic? If we all encounter resource constraints, every center that treats cancer patients would have that experience. How are we going to work together to make sure that patients are getting the care they need in those situations? And then how are we going to speak to the people that can help make decisions? And depending on where you are, it could be government, it could be philanthropy. How are we going to help them understand what is needed to do better for our patients? So investing in those skills and in our people is critical to moving things forward at the institution, the regional level, and for the country.
Thank you so much. I'd like to ask Christian and Daphne a question, and maybe I'll ask you to go first, Daphne, and then Christian. How did your experience in your leadership development program shape your leadership today, or your journey as a professional?
So the GOLD program has helped me a lot, especially during the sessions of insights wherein there was a deeper understanding and better self-awareness. I realized how my type of thinking affects how I communicate with other people and how I interact with them as well. And then I realized that we all have our biases and that we just have to work around all our biases and focus on the same goal as an organization. And that's how we proceed and become an efficient team as a whole. Another thing is that with the gold program, as the others has also mentioned, is it has increased my confidence more in my leadership skills. I felt like I was already a leader before, but undergoing this program has hastened it more and improved my qualities better. So I think that's how it has impacted me so far.
Very much. And for those who are on the call that don't know, Daphne mentioned Insights. It's a kind of a cornerstone of our leadership development programs. Insights Discovery is a company out of Scotland that actually really focuses on building self-awareness as a foundational building block for leaders. And then that foundational self-awareness leads to a greater humility for others and a better understanding of how other people work and think. So thank you for bringing up Insights. I think it's an important point. Christian, would you like to answer the same question? Let me know if you'd like me to read it again.
No, fine. I'm very happy to do so. And thank you very much for having me here. I do want to go one step back, if I may, and just thank Pramesh and Jose for their comments earlier. As a matter of fact, I think when I was reflecting on the program, and I'm one of the young leaders graduates, and also someone who benefited from the elders mentorship support, which Tina, I very much agree is and was probably the most essential component for me in my trajectory in developing my own path forward. But I want to go back to Pramesh and Jose, and if you permit for 10 seconds, very quickly read a poem, which is actually directly related to what you're asking, and it is a poem or a reflection by Giampiero Perligleri, who during the pandemic actually tried to understand why it was so difficult for us to feel connected in a virtual setting. And here's what he says. I spoke to an old therapist friend and finally understood why everyone's so exhausted after video calls. It's the plausible deniability of everyone's absence. Our minds are tricked into the idea of being together when our bodies feel we're not. Dissonance is exhausting. It's easier being in each other's absence than in the constant presence of each other's absence. Our bodies process so much context, so much information in encounters that meeting on video is being a weird kind of blindfolded. We sense too little and can't imagine enough. And that single deprivation requires a lot of effort. It came to my mind and I just pulled it up right now because it speaks to what your programs, Tina and Meredith, are actually trying to achieve, a sense of connection that goes beyond a simple relaying of skills and of rational approaches to leadership, but really fostering connection on a deeper, authentic level. I want to keep the rest of my answer short, but I want to say, on my own reflection, I think the major part of difference the programs have made to me is that after your programs, I actually felt identified with the organization I was working in. As an international medical graduate coming into the country in 2019, shortly before the pandemic, I did not as yet have a sense of identification with the organization and therefore could not even see myself as a leader independent of any potential skills or knowledge or attitudinal benefits I could contribute. This program, my program, participating at Young Leaders, made that possible, and I'm very grateful for it.
Thank you so much, Christian. Interesting. Maybe I'll just ask if anyone on the panel has anything you'd like to say. I know we have a list of questions, but if there's something you'd like to share, it'd be great to hear it.
I just would like to share that we are very excited here in Brazil to start a gold program at AC Camargo. Maybe we're gonna run in a different format that you have in Canada, but I have all the time questions from the residents when we are going to start, when are we going to have the application process, because they are very interested to know um, how is that? How is to be a leader and how they can influence the things that are going to manage in the hospitals that they are going back. Here at AC Camargo in São Paulo, Brazil, receive residents from all over the country here. And we have alumni in every state of Brazil. So particularly, I'm very excited to run this project here because most of our residents will not stay in São Paulo. They will come back home to remote areas or some places that are far from São Paulo. And we are very interested to know how we can teach leadership, or at least how we can transmit some concepts of leadership for them and to take part of AC Camargo to the rest of Brazil. So you are very, very excited, and the residents here are very excited too. Because we are going to run here for the residents, not for fellows. We discussed it with Tina, it's a little bit different from Canada and other places. But we are going to run for the residents, for the young professionals. And so we are very excited for this opportunity here. Your mic is off, Tina.
Thank you so much. It's really exciting, and it's interesting too because Pramesh has been sending folks from different regions and different centers in India for quite some time. So I don't know, Pramesh, if you wanted to say anything about that, what that looks like when you have this kind of distributed leadership development training.
So I think this is a classic example of what true leadership is all about, Tina. The very fact that instead of holding on to onto a very successful program, the leadership at Princess Margaret and the Global Oncology Program is so keen on distributing the learning that we have. To me, that's the essence of what leadership is all about, and this concept of distributed micro leadership is something that truly appeals to me. And I think you have such a domino effect if we are able to do that, if we are able to accept that we do it in multiple locations, multiple situations, rather than try and do it all on our own. And that's a wonderful initiative that we've taken within the Gold and the Bold programs.
Thank you very much, and it's been really wonderful working with you and others. It's amazing how much we learn and also benefit from you as faculty for these leadership programs, and really trying to get that global faculty. So we're having perspectives reflecting the people who are participating in the program. I'm curious to know if anyone on the call could answer this question, which is, what skills define effective leadership specifically in global oncology today, and how might these differ from leadership in other domains of health? Anything different about oncology?
I can take a first crack at that, but I'm sure there'll be others who will be happy to contribute. I think there's a lot in healthcare which is common, and I don't think oncology is dramatically different from other fields of healthcare. But the one aspect that I would emphasize here is the growing burden of cancer in low and middle income countries. In less than 20 years, more than 70% of the global cancer burden will be located in low and middle income countries. And it's not just a question of capacity or workforce that is a gap here. It is visionary leadership. And I think if we continue to take the steps that we are doing now, which is to build the leaders of the future, that's at least one step that's been taken care of. So this is one aspect where I think oncology differs from other fields of healthcare, where truly building leaders of the future in cancer would have enormous impact on the ground, given the growing burden in low and middle income countries.
And I guess, Tina, it's important to emphasize that it's important to this young leadership to understand that it's not only to develop a single or a couple of abilities. You need to have a systematic view. To have a view at a glance and to understand the system and to understand the differences. So you are going to be really a leadership. You're going to be a leader if you understand that it's not only a matter of to have a couple of abilities or skills, is to understand the whole thing, the whole scenario, so you can add something to the world.
Tina, if I may add, and I'm piggybacking a little bit on what has been said so far, I think taking a comparative systems approach and perspective is important. You need to understand that the patient journey, starting from waking up in country A, is going to be fundamentally different from the patient journey waking up in country B, C, D, etc. And this is not just a perspective of intercultural difference, but it really is a very structural difference of health systems alignment. And so an enormous amount of humility, but also ability to do proper interest holder analysis and understand in a way of a patient journey mapping, what does it actually look like for a patient in a particular healthcare system before they even reach the cancer center, before they even reach the point where a healthcare professional trained in cancer care can say, you unfortunately have the following diagnosis and we need to do X. I think this is what I learned over the past couple of years in this global perspective. And it is at the same time, going back to what Pramesh said, an opportunity for visionary leadership and for innovation, for actual disruptive innovation, where different health systems can learn from each other. And as a matter of fact, I have not found as yet the perfect health system anywhere globally. Most health systems can actually benefit from exchanging knowledge and doing health innovation together.
Thank you very much. I'm going to invite folks on the call to raise your hand if you'd like to ask a question, or put your question in the chat. And while you think about that, I've got a question for Daphne and Christian, which is just, what leadership skills have you used? I know, Daphne, you mentioned self-awareness, but what leadership skills have you used since graduating the program? And if you can think about it, what are, at a high level, some of the outcomes of those skills, using those skills?
Maybe I'll start off. Is that okay? Yeah. So I've enlisted at least 3 skills that have been very essential for me. So the first one would be, and I think is the most important, is adaptive communication. So this is very useful for me now as I work as the vice president of the Philippine Society of Oncologists. And there's a lot of meetings with the government. So this allows me to speak better to policymakers and even colleagues. And sometimes I realize it's in the choice of words and how you deliver the message more than the content of the message itself. So that's how I try to get them to collaborate with us, and it's been very effective so far. The second one is emotional intelligence. So qualities like empathy, that's been discussed earlier, and then being able to regulate one's emotions as well, especially when there are disagreements and the arguments are being heated already. So that's one of the most important things that I learned. And then the third one would be coalition building. So the GOLD program has also taught me that the real progress in cancer care doesn't happen in silos. It's actually when you are able to align different stakeholders around one shared purpose, and then that's when you'll have any possible change.
That's so interesting to hear. Thank you very much. Yeah. Christian, do you want to try that one?
There are so many skills and so many things to discuss. I personally maybe want to focus on advocacy for diversity, equity, accessibility of care, and having understood and learned that these are in our current days more important than ever. That it is very important, to Daphne's point, to find the right framing and wording and understand how any message that you deliver can also have a strategic and political component. And therefore, you need to choose your words in a way that the recipient has permission, if you will, in their context to accept your message. It is sometimes not so much about not wanting to collaborate or not feeling like partnership is the better idea. I think most people in healthcare understand that collaboration and integration is the better path forward. Sometimes it is important to take a step back and think about what kind of messaging can the other party or the other parties actually accept at this moment in time of their particular context. So really thinking strategically about, or as I would call it as a psychiatrist, mentalizing the position of the other, be it an individual or a group, is a very crucial leadership skill that I think I take away from the program and from the very meaningful fireside or chats that we had with leaders, including also going back to the mentorship program that you mentioned from our PM elders. Absolutely crucial.
Yeah, I just wanted to resound that the mentorship program, I really appreciate that because I didn't realize that that was super vital as a leader to have a very good leader as a mentor.
Don't see any questions yet, so I am going to ask another question, but please, folks online, if you do, don't hesitate to put your hand up or put a question in the chat. I want to ask you oh, Christian, please.
Tina, my apologies. I'm very sorry. Just it seems like Daphne and I are currently bouncing off each other, but I want to make an additional comment on mentorship because there is sometimes an overuse and overutilization of the concept of mentorship, I feel. And there can sometimes be a perception that, just having a mentor is ticking the box of being in mentorship. I think it is extremely important, and it was certainly very important in my own development, to be very self-critical and also very honest to myself about who I can accept as a mentor. Of course, also who accepts me as a mentee, needless to say. But the match is really, really important. And if mentorship becomes more of a tick box exercise so that you are part of your requirements for accreditation, for promotion, for whatnot, but mentorship is not filled with an intrinsic motivation, then it can very quickly become shallow and actually trickle out. And I want to say, I had that experience from both ends, but I also had the experience from both ends, how it feels like if a mentor actually takes you under their wings and kind of lifts you up alongside them. And I think that's the kind of mentorship that we're all looking for. And one point that I want to make on this is I've always in my career so far over the last 25 years really sat down and thought about who would I like to get mentored by? Who do I think has something to offer that I really lack, where I really have a gap? And then I simply reached out to the person. So the informal leadership and mentorship training that I have received through people who simply were willing to sit down over a coffee chat with me and then maybe became formal mentors has been absolutely instrumental. So I want to encourage everyone on the call to not be shy about reaching out and requesting a meeting as a starting point for sometimes very, very meaningful relationships.
That's true. I just go straight up. Can you be my mentor? And then when we have those fireside like meetings, sometimes you agree with them, sometimes you don't. You don't have to really follow everything that they say. It's more of like having a lot of opinion and comments as well, and different mentors. And then you come up with your own type of leadership style. Yeah, thanks.
Interesting comments.
Jose, did you want to say anything else?
No, just interesting comments coming from Christian and from Daphne. Thank you.
We've actually developed a mentorship orientation to train people on how to be better mentees as part of the program, because we think like it actually is, it's a make or break, like knowing how to approach it with that humility and openness. So yeah, I'm really happy you brought that up. I just wanted to ask, maybe we'll ask Pramesh first and then Jose and then the alumni. As you look toward the next decade in global oncology leadership, what do you think some essential competencies will be for the future?
So I think you alluded to one of those, Tina, in your presentation just before the panel, and this is the concept of servant leadership. I think we need to move through those 4 phases that you showed. The one of this big, strong man who was born with these attributes. Often it's a man, middle-aged, paunchy, elderly, white-haired. So we have this archetypal description of what used to be considered as a leader. And we need to move into this concept of servant leadership where you realize that your actual purpose of being a leader is to actually serve and get the best out of people who work with you to make sure that your outcomes are fulfilled. So to me, that's a fundamental concept. And often this just comes in by trying to put yourself, and I think Christian mentioned this when he spoke as well, is just to try and put yourself into their shoes, try and figure out how they would respond to a situation and not be kind of unidimensional in the way you think about it. And can't agree more with what Daphne mentioned about the power of collaboration. We far too often, so when I speak to some of the cancer center leaders as to what their ambitions are, it's very often, I want to make my cancer center the best in the world, much better than anyone else. And I think it points to a very fundamental flaw in our way of thinking. By wanting to make your cancer center or your hospital or your organization the best in the world, you're automatically creating a gap between organizations, and that's exactly what we want to avoid. The true purpose is to actually have, regardless of where you're born, regardless of which pin code or zip code you belong to, have access to the same level of life that you're used to. So I think that's something that's critical.
I guess for me, the leaders must think about how to introduce artificial intelligence in the system in the way that can be ethically acceptable and not to promote that gap that Pramesh just mentioned before. I have been thinking about how can we use artificial intelligence to promote the development of the system, to development of the professionals. But I should be honest, I don't have the right answer right now, because all these things in terms of artificial intelligence today, all the things are not very clear. I'm really worry about how we can introduce this as a leader. How can introduce the artificial intelligence, our responsibility for doing that, and how can we do this in an ethical way? So I guess in the next decade, the big challenge for the leaders is how to introduce artificial intelligence in the system. This is my opinion.
I think it's a good place for us to close off because we're all pondering the same thing. And something that we need to learn together. And I think that's another big benefit of having these global networks. We can learn as we go and share together. So I just want to thank everyone on the panel and for coming out and joining this conversation. It's been so great to talk to you. And also thank you everyone who's joined as a guest. It's been really nice to share our work with you, and please consider collaborating. Reach out to any of us. We'd all be interested in chatting. So thank you so much.
I appreciate it a lot. Thank you.
Thank you.